Hi, my name is Ashley McNay, and this is my chest and abdomen assessment. Okay, knock, knock, knock. Hello, my name is Ashley. I'm just gonna wash my hands. I'm gonna be your nurse today, and I'm gonna be doing an assessment on your chest and your abdomen. Do you have a cough today?
No.
Any difficulty breathing?
Nope.
Um, Chest expansion is equal bilaterally, and the AP ratio is 1 to 2. So I'm gonna first palpate for tactile fremitus. So I'm gonna have him sit up. Go ahead and sit up. Every time I do this, I want you to say 99, okay?
99, 99, 99, 99, 99, 99.
There was no changes in vibrations. Then I'm gonna auscultate in a Z pattern. And I would do this both laterally and anteriorly too, but for the sake of this exam, I'm just gonna do posterior. Okay, I'm gonna listen again in a Z pattern and check for agophony. And I'm gonna have the patient say E every time I move my stethoscope. Say E.
E, 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 E,
There was no changes from E to A. And that's normal. We should not hear A. So then I'm going to have the patient lay down and I'm going to check the chest for heaves and thrills. To check for thrills, I'm going to place my palm on the 4 heart spaces. There's no thrills felt. To check for heaves, I'm going to place my hand on the left sternal edge. There were no heaves. Next, I'm going to listen to the heart sounds. So the aortic is heard in the second intercostal space to the right of the sternum. The pulmonic is the second intercostal space to the left of the sternum. And then Erb's point is in the third intercostal space to the left of the sternum. And then the tricuspid space is tricuspid area is heard in the fourth intercostal space to the left of the sternum. And then the mitral or the apex area is fifth intercostal space mid-clavicular to the left of sternum. S1 is heard loudest at the base of the heart, and S2 is heard loudest at the apex. Oh, I'm sorry. S1 is heard loudest at the apex, and S2 is heard loudest at the base. Then I'm going to check the peripheral pulses, starting with the temporal. It's about a 2+, and the carotid on one side. Change positions. About a 2+. And listen for the feel for the brachial, which is here. And then the radial. Brachial is about 2+. Radial 2+. And then the posterior tibialis. Go ahead and raise your foot. Doing it on the opposite side so that you can see it. But the posterior tibialis is here. It's about a 1+. And then the dorsalis pedis is here. And it's about a 1+. Okay. Lower your foot. Normally I would do this bilaterally to check symmetry, but for the sake of the video, I'm only doing one side. And then I'm going to move on to the abdomen. I'm just going to start by asking some questions. Have you had any changes in appetite?
No.
Any difficulty swallowing?
No.
Do you have any abdominal pain?
No.
Any nausea or vomiting?
No.
When was your last bowel movement?
This morning.
And how frequently do you have bowel movements?
About every day or so.
Okay. Do you have any pain or discomfort when urinating?
No.
Excuse me. What kinds of do you take any medication for GI issues like irritable bowel syndrome, ulcers, indigestion, or anything like that?
No.
What kinds of foods do you eat?
Like red meats, fish, pasta.
Okay. Do you have any history of ulcers or UTIs?
Nope.
Do you have any history of have you had any abdominal surgeries or injuries or trauma to your abdomen?
No.
Okay. Any histories of colorectal cancer or related cancers?
Nope.
GI tract. Okay. Then I'm going to inspect the abdomen. The shape, the abdomen is flat and non-distended. The skin, there doesn't appear to be any abnormalities, and it is warm to the touch and appropriate for ethnicity. The umbilicus is midline. There don't appear to be any pulsations. And his abdomen looks symmetrical and hair distribution looks even. There's no redness or cyanosis or striae or spider nevi or anything like that. Can you raise your head for me? There don't appear to be any masses or hernias. Then I'm going to auscultate in all 4 quadrants. Do you have any abdominal pain?
No.
Okay, I'm going to do light palpation and deep palpation starting in the right lower quadrant. Let me know if you have any pain. Deeper. Okay, and then I'm no pain with that?
No.
And then I'm going to percuss. Tympani was present, which is normal. There was no dullness noted. And then I'm going to check for the costovertebral angle angle tenderness. Go ahead and sit up for me. Have any pain with that?
No. No.
Oh, good. Okay. And that concludes my abdomen and chest assessment.